Evening, healthcare is taking a hit in Port Hardy, and the locals fear that rotating closures in the emergency room could cost lives. There's a serious shortage of doctors and nurses in the North Island community, and some days that forces the emergency room to shut down. Patients are redirected to Port McNeill's ER, which is a half-hour away. As CTV's Gord Kurbis shows us, executives from the Vancouver Island Health Authority were on the North Island today, trying to reassure the community that there is a solution in the works.
An ambulance pulls up to the emergency department of Port Hardy's hospital. Today, paramedics know the ER is open for business, but that's not always the case. A situation many say is unacceptable.
The problem has been terrible for the last few years. It's taken this question of possibly closing the emergency room full-time to get VHA to act.
Staffing shortages have led to the emergency room having to shut down for periods of 24 hours or longer on numerous occasions over the past several years. Port Hardy's mayor says her community deserves better.
We have seniors, we have young people, we have babies, we have very vulnerable people in our community who need very good medical attention, and some of them need to have really good access to emergency services.
The hospital services Port Hardy's population of 4,000, along with more than 1,500 others who live on the surrounding First Nations reserves and in isolated communities. They say the constant closures are hurting them.
That means traveling to Port McNeill or further for any serious problems, or for people who don't have much money. It's a big deal.
Bonnie Weldon's husband fell off the roof 5 years ago, and he was rushed to Port Hardy's hospital where his life was saved. She says if the ambulance had to travel all the way to Port McNeill, where patients are redirected when Port Hardy's ER is closed, he wouldn't have made it.
Half an hour to where? At Port McNeill? So we can bleed to death, or like my husband wouldn't have made it half an hour from here.
Today, directors of the Vancouver Island Health Authority were facing tough questions by members of the Mount Waddington Health Network. CEO Howard Waldner tried to reassure them that VHA does have a solution.
I can assure you here today that VHA has no plans to reduce any service in North Island, and in fact our mandate right now is to grow and develop services to meet the needs of the population here.
He says doctors are now committed to working towards better coordination for their vacations. Plans are also in the works to bring Port Hardy's clinical leaders together in a single location.
Interdisciplinary health practice by a team of health professionals isn't new, but it would have to be adapted to fit the community here. It happens across the world.
Waldner says there will be no more closures of the ER between now and the end of the year, and a more permanent solution should be in place within a year. But were his reassurances enough?
You can ask me that question in 6 months. I'll tell you whether or not I'm reassured that things are moving along as they should. We do need to have really good communication with them to make sure that is happening.
Gord Kurbis, CTV News, Port McNeill.